Welcome to Clear on Health.
TSTV, connecting your world.
Good evening, viewers. Welcome to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. I'll be your anchor today. With me in the studio is Mrs. Jane Abo. She was with us last week where we discussed different topics relating to, pregnancy and women. So last week we talked about antenatal care, the reasons why we felt it was important for women to seek antenatal care. We talked about normal delivery, expectations during normal delivery. We also talked about difficult deliveries. Today we are going to be talking about the postnatal period. Now this is one of the periods in the woman's after pregnancy life that can be overlooked because sometimes they just feel it's not important, baby is here and then it's time to go home and rest. But this is a period in a woman's life where she has to be careful and look out for certain signs. So Ma, what do we call the postnatal period? How do we explain it?
Good evening, viewers. Postnatal period can be defined as the first 6 weeks after the birth of a baby. It can also be called the postpartum period or the puerperium. At this point, what happens that it begins immediately. Immediately the child and the placenta is born. Postpartum period begins. Yes. And then at this point, what happened is that, during the antenatal, we learn that pregnancy is a physiological process. So during the postnatal period, the effect of the pregnancy on all the body systems, they are supposed to have returned to their pre-pregnant state. In fact, majorly normal deliveries within these 6 weeks of postpartum period, or maybe 42 hours. Yeah, all the effects, or the effect of the pregnancy on all the systems of the body, they must have returned to their pre-pregnant state. Yes.
Okay. So that's the postnatal period.
That's the postnatal
so
period.
It's between immediately after delivery.
The child is born. Comes put it at the end of the pregnancy. Okay. The moment delivery takes place, once the baby is born, up to the 6 weeks, the first 6 weeks of the baby's life and the mother, that's the postnatal period.
So Ma, why would we say the postnatal period is important? Why do we look out for that period?
Yeah, the postnatal period is very important for the mother and the child. Especially for the first-time mothers, they look up to it because you've been carrying a baby you've not seen. And one thing with pregnancy is that when it comes to term, you're so eager to see that which has been growing in you for the past 9 months. And then at this period, you're seeing the child. Yeah, you're seeing the child. That maybe it's your replica or your husband's replica. The joy of motherhood has no equal. Nothing can be equated to it. So it's a very important period that all mothers look out for. And and then to we, the health workers as well, to us is a critical time, especially the first 1 hour, yes, and then going again the first 7 days, 2 weeks, and even on to the 6 weeks that we talked about. Because a lot of things could happen, both to the mother and also, the child. And then there are certain things you actively look out for. Okay. Because the baby is being born, yes, the placenta delivered, what about bleeding? Yeah, bleeding could happen at such point. So we emphasize that it's important to us and to them too, so that we know that such things are not occurring, like what we call a postpartum bleeding, because that has laid a lot of women to death. And that is one thing we don't want it to happen. Yes, I read by World Health, they say that for the reproductive health, postnatal period of care is the weakest of all. Because as soon as the baby is born, they are like, oh, I've gotten what I'm looking for. So what next?
What next?
Yeah, so that as soon as they are discharged from hospital, they don't want to come back for a check.
Yeah.
And that is the essence of this talk. To tell them the importance of the postnatal care or postnatal check.
Yes.
It is very, very important because at that point, we want to see that both the mother and the baby, they are healthy. We want to know the state of the woman.
Yes.
Yes, we want to know also the state of the baby. Because especially for the baby at that point, that's when you try to initiate breastfeeding. Breastfeeding should start immediately the child is born.
Yeah.
And then, you know, normally when a child is born, the first 14 days, they are bound to shed weight. They are bound to lose some weight. But during the postnatal care, you have to weigh back the child to see if the child is really being fed well. You initiate the breastfeeding or whichever alternative feeding that the child is having.
Yeah.
And then at that point also, you now look for, you also educate the woman. But everything culminates back to even the antenatal. Because during the antenatal, the mother must have been advised on what to do when the baby is born, on herself and also on the baby. So that's why we say that some women that wouldn't want to come for antenatal, they have that they are missing out. Because at that point, you want to initiate the immunization to be sure that the child is also taking the correct immunization. Then we talk about the cut care, because which is very, very important, because that appears to be maybe one of the opening and the easiest way that infection can to cause a neonatal sepsis or stuff. Yeah, you look out for that as well during the postnatal period. And also these common conditions of baby, which is called jaundice as well. You look out for it too, because some mothers, they don't even know. You know, one common sign with jaundice is the yellowy discoloration. But to some mother, maybe they just think their baby is light-skinned. They don't even know whether it is disease condition or not. But when they come in for the postnatal, we could identify such as well. All is leading towards the well-being of the baby. We also want to ensure the nutrition of the mother as well. Is the mother feeding well? Because one of our aims is to see that the mother and the baby are bonding well with exclusive breastfeeding. And you know, the woman has to be in a good state of health to be able to successfully breastfeed her baby as stipulated by World Health. So we want to look at the nutritional aspect of the woman. We want to check also her blood level as well. All those things are the things that we look out for that makes the postnatal period a very good time. But it's like it's taken for granted by the mothers because as far as they're concerned, they have been expecting the baby and now the baby is here with them. But you discover that there are more to it
than that.
Yes.
Thank you so much for that answer, ma'am.
And then another thing again, importantly, at that period, that's when we try also to talk about family planning. The options are valuable for the women. Just like we say, like the popular saying goes, body no be wood. Some men, they don't really mind within that period, though there is all this what we call lokia that is still draining, but some don't mind. They still want to go in. And we all know the essence of family, just to prevent an unwanted pregnancy or also to space in between the children. So during the postnatal period, we also want to talk about the available family planning options at that period as well.
Thank you for that. That answer. It brings to light the importance of the postnatal period, the reasons why you should be taken as seriously as you take antenatal. So, ideally, after a woman delivers in the hospital, when should she be discharged? If we say what's the ideal practice, what the ideal practice should be, when should she be discharged? Because everywhere there are different things that we hear and we see. You know.
Yes. There hasn't been like an agreed maybe hours or days, as in when a woman has delivered, she should be discharged home. It's like individual hospitals or clinic practice that which is best convenient for them. I realize that that's what is obtainable at the moment. Some facilities will advocate for a 24-hour observation. after the baby is born, before the mother is discharged home. Some will say 8 hours post delivery.
Yeah.
And then there are some situations as well that within 2 hours of delivery or 4 hours. And I've even seen even the patient that says they are pushing the hospital management, oh, I've delivered,
Yeah.
discharge me home. So there hasn't been an agreed time, duration, whether it should be hours or it should be days. But based on my experience, I think if a woman put to bed, she should still stay in the hospital and be observed for at least the next 24 hours.
Very important.
Yes.
Very, very
Yes,
important.
so that you can observe her for any bleeding and also observe the child also for
yes.
any change. Yes, so that thereafter, after 24 hours and you're satisfied with the condition of the mother and that of the baby, you can then discharge them home with the peace of mind and giving them day to come for the antenatal.
Okay.
Because I say sorry for the postnatal
Yes,
check.
check.
But most of them, they don't even come at all. The next time you see them in the hospital after delivery, that they are coming for immunization or for other condition, which is not really nice. Yes.
So we see that it's so important that immediately a woman delivers, you've had your bundle of joy, that you and the bundle of joy, we don't want any mishap happening, and then you need to be observed, baby needs to be observed. So leaving the hospital on time, or even pressure the healthcare provider to say, okay, I want to be discharged, allow me go home, it's time, my family members are waiting. You are putting yourself at risk, and nobody's going to be responsible for that risk. So you need to look out for your life and the life of your child. So it's really important that you listen to your healthcare provider about whether to stay in the hospital for 24 hours or whatever is obtainable in that facility, so that every other thing that can come up after delivery is prevented. So we'll be going on a break shortly, and then when we come back, we'll keep talking about the postnatal period. Thank you.
To recharge your TSTV decoder, simply log on to www.buytstvvouchers.com. Click on sign up, fill in your details, name, email, phone number and password. Click on create, then log in with your email address and password. Click on buy voucher, select the voucher of your choice, pay with your card or wallet. Enter your decoder serial number and voucher pin, click on load, or you can get your TSTV voucher from our dealers nationwide. You can also contact Kalak Power on numbers and details showing on the screen. TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back, viewers, to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. With me in the studio is Mrs. Jane Abo. We've been talking about postnatal period and why it's important. So before we went on the break, we talked about the period we call postnatal period, and then we talked about the importance of this period in the life of a woman and the reason why it should not be dismissed and it should not be overlooked. The reason why people should come to the hospital for their appointments. We also talked about the ideal time a woman that delivers should be discharged. So, Ma, what are some of the complications of labor that can be seen during the postnatal period? What are some of the labor complications that we can see during the postnatal period?
Okay. I think the most commonest one is the what we call postpartum bleeding or excessive loss of blood.
Yes.
And that comes when you have a filled pad over one pad, well-soaked pad in an hour. Then you can assume that that woman is having a postpartum bleeding, or the bleeding is in excess. Yes, that's one of it. One of the complications. Then we also have an infection. Infection is very, very common as well. And with the infection, it then leads to what we call subinvolution. Because the period of postnatal, the uterus is believed to have come to its pre-pregnant state.
Yeah.
That is, it moves from being an abdominal organ to become the pelvic organ where anatomically it should be. But whereby infection sets in, that can be prevented so that you could still palpate the uterus abdominally. So that is also one of the complications. Then another one is a rise in the blood pressure. A woman who has had maybe blood pressure, high rise in the blood pressure during pregnancy, and it's possible to continue also during the postnatal
Period.
yes, the postnatal period. Yes. There is also what we call puerperal psychosis. It's not too common also, especially for a woman that has a well education during the antenatal time, because there are certain things that lead to that problem. Yes. Sleep deprivation is also one of the complications too.
Yeah.
Though I think we are coming to we are coming we are coming to that topic as well.
Yeah, okay.
And there's some of them too. I don't know. What they call postpartum depression. There's just a mood swing change in them, and they just get depressed and just their behavior changes. Yeah, that's one of it too. And also one of the complications again is mastitis. The breast getting too engorged, or maybe for whatever reason the ducts are blocked, and then there isn't a free flow of the breast milk, and that could also be one of the complications of during the postnatal period. Yes.
So thank you so much, Ma, for that. You gave us, even went beyond labor to, the things we should generally expect as complications in the postnatal period. So, Ma, can we talk about postpartum blues?
Okay.
Yeah, you mentioned depression, you mentioned psychosis, because so that people that have certain, maybe after they deliver out, some of them don't want to touch their child. Yeah, the child is irritating them, people are irritating them. We don't look at the public or the people who are trying to educate, do not look at them like they are possessed or there's something, these people are not behaving normally. It can actually happen after a baby is delivered. So, Ma, let's just talk about postpartum blues. What is postpartum blues?
Yeah, postpartum blues is a temporal psychological state of the woman after birth, which is characterized by the mood swing.
Okay.
Their mood changes. This very minute they are so excited and happy, and then the next minute they are sad.
Wow.
Yes.
Okay.
So that is, and there are so many things that manifest at that period as well. They lack concentration.
Okay.
Then there's that anxiety, there's that anxiousness in them. It's like maybe I don't know how it works, but it's either what they are expecting is not really there anymore. But there's one thing I discovered. This is practical now about postpartum blues, or some people call it baby blues. If it is not well controlled or well handled, it goes into proper psychosis. I've seen a woman, how they change in behavior after delivery of a baby.
Okay.
Yeah, and honestly, in fact, up till now, though she's been on some psychotic medications, but it shouldn't be really, because by the definition, it's supposed to be temporary. Okay. Yeah, for whatever reason, due to lack of rest or poor education on what they should anticipate after birth, and then they begin to manifest those signs.
Okay.
Yes.
How do we look out for postpartum blues? Because I think now we're looking at the family relatives, husband, mother, sisters, anybody around the pregnant woman or the woman that just put to bed at that time. How does she look out to say, okay, we think we need to draw attention to this patient?
Just like I said, when I gave the definition, it comes with the main thing is the mood swing. You can't really predict them.
Yeah.
At this very minute, they are so happy with the baby, and they're equally, they are also sad. Yeah. And then at times also, if you watch them very well, there's this attempt to hurt the child. Wow. Yeah, some of them go to the extent of hurting the child. It's like they fail to recognize the child, identify the child as my own. Yes. And also, if left alone as well, they want to like hurt themselves as well. Yeah. And then also, you look out for things like lack of sleep. After delivery, you're expected to be tired, and then you want to take some rest so that your body can relax.
Yeah.
Yeah. Once they were about to manifest their blues, they lack sleep. The sleep won't be there. Relaxed. Yes. And then there's what is called a cry spell. You see them trying to, they cry unnecessarily for no reason, for no fault. You just see them shedding tears. So that is one thing you look out for. For any woman that delivers, and instead of her being joyful, she's rather crying. Know that she's suffering from this puerperal blues. Okay. Yes. And there's this anxiety in them. And then they also become restless. Normally after delivery, you're tired. All you want to do is just to maybe take a shower, take a hot drink, and then rest. You see them, they are up and doing. They're just walking up and down. They're just agitated. They are restless. They don't want to sit down. They don't want to lie down. Then, yes, they lack also concentration. Wow. Yes. Wow. There is difficulty in all. They are irritable. When a woman gives birth and she's irritable, just be watchful. Just be watchful.
Well, it's good for us to talk about this because mental health in Nigeria, once somebody does it, they'll say, this person is crazy. But it is really a very important part of our general health.
Yes.
Mentally, you have to be fine. So if in pregnancy something like this is coming up, it's not time for you to start saying there should be something wrong with the woman or start going to superstitious belief or whatever. It's good for us to take note of these things, see the doctor or healthcare professional, and let it be properly diagnosed so that help is rendered at the time we need to render help.
Yes.
So, for postpartum blues, can we avoid it? Is there anything the patient can do to avoid it?
Yes. One of the key things is a good antenatal class. Because I think maybe there are some expectations that they are expecting and they are not getting.
Yeah.
That could get them irritated and also anxious.
Anxious.
Yeah, so it boils down to the antenatal again. We can never, so long as you're talking about the mother and the child, we cannot stop talking about antenatal.
Okay.
So a woman that has a good antenatal lessons, she'll be well prepared.
Yes.
Whatever she's expecting, or whatever might be her questions during the antenatal classes, the answers might be given to her, which will relax her mind. Yes. So that is one of
the ways to avoid.
Yes.
Okay.
And also trying to make friends with maybe people who has had the experience before, especially for the first timers. You know, the anxiety, you don't know what you're expecting.
Yeah.
They will know having a baby is time consuming and all of that. But if you have a friend who has had children before,
Yeah.
some of your questions you can ask her, and then she could answer you. Even without you asking, she could just tell you, oh, I know you're expecting these are what you're to expect. And that gives you a peace of mind. So that when such issues come, you now reflect back and know how to, yes, and yeah, you know how to handle it.
Yes.
Yes. And then importantly again is the family also, the spouse support, the husband support. This period is a period that the woman needs the support of the husband and the family members. We should not leave them alone, because sometimes restlessness too. Like I have an in-law that suffered puerperal abuse. I think it was due to exhaustion, tiredness, overworked. She was all alone. Nobody came to her, and that was her first baby.
Wow.
Nobody came to assist her. You know, the mentality of the African man, the baby is the mother thing. The man just get dressed and leave her and the baby to go and hustle for what the family will eat. And the lady was left alone to care for this baby, and this was her first time. And then before you know it, she became irritable, anxious, and all of that. So the husbands should play a role by giving them all the support they need psychologically, socially, economically, otherwise, and also be there by their side to reassure them. Make them realize also that you love the child as well. Because sometimes it's like, this baby is just you, the woman that needs it. It's not the man. And then at such point, you know, you feel somehow. Because it takes two to bring a child to this world. And now the baby is here. The joy you're expressing, you're not seeing it being expressed by the father as well. And it makes you to begin to think otherwise. So our husbands should please give us that support that we need at that point. And also the family members.
Yes.
The mothers, the fathers, the sisters, especially the female relatives. They should come around also to tell us one or two things that we don't know and we want to know, that will help us and make this period easy for us. Yes. By having all this around you, puerperal blues is bound to be avoided.
Thank you so much, Ma, for that explanation. So we'll be going on a break shortly, and when we come back, we'll continue talking about postnatal period.
To recharge your TSTV decoder, simply log on to www.buytstvvouchers.com. Click on sign up, fill in your details, name, email, phone number, and password. Click on create, then log in with your email address and password. Click on buy voucher, select the voucher of your choice, pay with your card or wallet. Enter your decoder serial number and voucher PIN. Click on load, or you can get your TSTV voucher from our dealers nationwide. You can also contact Kalak Power on numbers and details showing on the screen. TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back, viewers, to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elisoji. With me in studio is Mrs. Jane Abel. We've been talking about postnatal period, and we've explained what the postnatal period is about, why it's important. We talked about one of the things that happens during postnatal period, which is postpartum blues, and then we talked about how we can avoid that from happening, and the reason why the woman needs that psychological support, family support, and to be educated by her peers and educated even during the postnatal period about her expectations in the postnatal period. So we'll continue with our discussion, and the next thing we're talking about is omugo. Now, omugo is something that is practiced. It's actually a term from the Igbos in Nigeria. Nigeria is something that is used to illustrate when the mother-in-law comes to help the woman when she delivers. So, Ma, we're going to talk about Omugo. Why is this practice important?
You know, it's important because it has a lot to do. It helps the woman, just like we just talked about how or what to do to prevent puerperal abuse. And one of it, we talked about the family member. Omugo, just like you said, is one of the practice in the eastern part of Nigeria,
Yes.
whereby after a woman gives birth, the relative, or most times is the mother or the mother-in-law, get all their native meals, yes, down to where the couples are staying,
Yeah.
to come and prepare for them, and also to give them psychological support, and also to give them a helping hands in the issue of the baby, the birthing of the baby, and also the birthing of the mother. Because, you know, even though we in hospitals, we believe that once it's a hospital delivery, we try as much as we can to, like, clear the uterus of every blood clot and all of that. They still believe that there's this kind of bath that they give to the women to expel the clot. So when the mother or the mother-in-law comes, she wants to do that. So that's one of the importance of the Omugo. Yes, they also come to assist the woman also in the care of the baby, especially for the first time, as a woman having a baby for the first time. You know, some of them even right from the antenatal, they'll tell you, oh, my only problem is how to birth the baby, because the baby is too tender. I don't know how to do it so that I don't break the bone, I don't suffocate the child, and this and that. So at this period, when the relatives come, it could be anybody, someone that is related to you, that loves you and want to come and share in your joy. And when they come, they assist in the care of the baby. Yes. But one thing I tell them again is that, you know, the practice of our mothers of old in the care of the baby is somehow harsh to the way we are doing it now, especially in the court care as well. Because I've seen in a hospital, yes, I was just passing through and I looked through the window and I saw a woman mixing Vaseline, toothpaste, blah, 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 and was applying on the cord. So you see, and that's not really nice, because infection can set in. So I advise mothers, expectant mother during antenatal, that when whoever that is coming to give you a helping hand during this period, you should watch out, even when they are birthing your babies. Because you see some of them, they will birth and do this, do that, press the nose, and because they believe by so doing, it aids in evolution. And truly it does help in evolution. It does help the women. Yeah, because some women, after that, you see them within 6 months, they are brought back to shape. They are in their normal pre-pregnancy state, and even come for postnatal check, even doing palpation, everything is just, so it does help. So it's but we should still watch out. And we should still watch out, especially on the baby, and the way they treat the babies. And also even for the mothers, because even some of them, for women who didn't have a normal delivery, maybe like surgical intervention, cesarean, they still insist on batting them and pressing the wound, not knowing there is an incision on the abdomen already that could give up, that could tear open. So all those are habits you try to discourage. Any habit you know that could be harmful to you or to the child, you discourage whoever that is coming to her. But it's a good way in our Africa way of helping a newly born mother.
Yes. One of the things I like about being, will I say an African or a Nigerian, is the fact that we treasure family support. We yes, and it helps us as new mothers to be able to, know what to do, be informed. We treasure family support. So Omugo is it's a useful practice, but it has its bad side. I watched a video somewhere and the woman was batting the baby. And if you see the way she was hitting the child, like everybody that, I think it was posted on a social media page, and the comments was, how can you beat my child like that? You know, because it's very important that even as the mother, as you know, weak and you want people to help you, you should also be very observant. You can't just go and sleep and leave your baby for somebody to press everywhere and bend every bone and you know and say they know what to do. They are the older people. That's why the antenatal period is also good, because I think these things are talked about so that you are informed about what to expect and all that. So are there other bad practices on Omugo that we've not mentioned? Because we talked about
yeah, one other thing again is capital intensive, because after they have come to assist, when they are going, a lot that is expected of their in-law to give to them, especially if whoever that is coming to render the assistance is from the wife's side. And so much expectations, clothing, food items, lot and lot of things, in addition with raw cash that the woman has to go to the village with. Because I learned, I think it's even being celebrated somewhat. When the woman goes home, she will like display the items. Exactly. That's to display the luxury of the in-law, that my in-law bought this, bought that. So that you see that, so for some families who cannot afford that and they needed this assistance, they can't dare it. So that is one negative aspect of it. Yes, but if they can make it a bit moderate, just like we talked about that we're Africans and we cherish family, it will be nice. But that aspect is somehow not really friendly to most couples who are financially managing their lives.
Yes. So thank you so much for that explanation, Ma. So it's really important. We like to have family support during the delivery of a baby, and to help the woman know so much, know how to take care of the baby, know how to take care of herself, the necessary things. Please, when someone is coming for Mugo, it's good that you look out for what the person is going to be helping you do. It's good to respect our elders, respect our parents, our grandmothers or mothers, but please always pay attention to your baby. Don't just leave your baby and say, okay, this person knows what to do and I want to rest. The labor and delivery period was stressful. It's good to just take note of what they are doing to your baby. And also, please, for our parents and mothers that are coming, please, it's good for you to, don't demand so much. This relationship is better than any other thing. Eventually they would give you what you want, but please, so that the woman has that support. We also talked about postpartum blues. So a way to prevent postpartum blues is her having that necessary support, from the parents and all that, and people around her. That's very important. So Ma, we're going to be talking about eclampsia during or preeclampsia during the postnatal period. We know it happens it can happen during the antenatal period when the woman is pregnant. So what are the things that we would look out for? Because we are saying these things because some people will deliver and now show up in the hospital. Even sometimes it's the next delivery you see them. So what are the things that they should look out for that will say, okay, this is a danger sign, and the reason why you need to prioritize coming for postnatal things?
Every segment of this maternal health is important. The antenatal, the postnatal. Though to a certain level now, the women are beginning to know the benefits of the antenatal. But for the postnatal, it makes no difference. It makes no meaning to them. But it's very, very important. Now we're talking about preeclampsia. That's one of the states that the woman can fall into. But with antenatal check, that can be curbed. That can be prevented. Preeclampsia is it's a condition. It's a condition that leads to a rise in blood pressure and also protein in the urine of the woman. But it can get worse, that it can lead even the woman to an unconscious state, even to coma and even eventual death. And we don't want that. We want the joy to continue. The joy that you've had your baby should continue as you see your baby grow healthily, and also you're healthy to look after your baby. So when you come for antenatal check, these are the things we check during the antenatal. We want to see the bonding between you and your baby. We want to see that the baby is being fed We check the weight of the baby. We also check your weight. We take the vital signs. We check your blood pressure, and parameter is going high. It could be better. It could happen that you have a you were normatensive. Your blood pressure was normal during the antenatal, down to delivery. On getting home, something could trigger it, and then there will be a rise in it. But if you don't come for the postnatal check, how then will you know before it gets worse into eclampsia, fitting, and all the associated dangers? So it is important that you come for the postnatal check, so that if that is detected, because when you come for the postnatal check, if the BP is high, they will also subject you to urine investigations, and then if protein is seen in it, the doctors, the obstetricians will know the intervention, so what to do to prevent preeclampsia or eclampsia itself, because it's a very serious obstetric condition that can be prevented if only we can
discover it on time.
Yes.
Thank you so much, Ma, for that explanation. So you see the importance of coming for your postnatal clinics. It's very important that, you know, if there was blood pressure during the delivery, after the delivery has happened, I mean during the pregnancy, after the delivery has happened, it means you need to also look out for that blood pressure. Is it coming down, or it is? It's very important that that is monitored. Although one of the things that sometimes can increase blood pressure during, during the postnatal period, is not sleeping as much.
Yes.
Baby is there, so now she's waking up at night to breastfeed.
And measure
every 2
sleep
hours,
deprivation as one of the complications of.
So sometimes it can also increase the blood pressure. But it's good that you have that adequately monitored. Let it not be that it is pregnancy-induced hypertension or preeclampsia that you are trying to develop, and you just think, oh, it's because I'm not sleeping well and all that. And sometimes the BP monitor is not even in their house.
No.
So it's only when they have a contact with coming to the hospital.
Has a BP apparatus to monitor their BP.
So this is very important.
Even for those who are diagnosed of having a high blood pressure.
So it's very important that we follow up on that blood pressure. Is it getting better after that delivery or not? So we'll be going on a break shortly, and then when we come back, we'll keep talking about postnatal periods. Thank you.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome back to our program Clear on Health on African Health Television. My name is Dr. Fumila Elisoji, and we've been talking about postnatal period. I am joined in the studio with Mrs. Jane Abo, and then we've been explaining different things about postnatal period and certain things that you need to look out for and why it is really important. So Ma, we're going to be talking next about the care of episiotomy and perineal laceration. Now during delivery, sometimes the woman has a tear given to enable the head of the baby come out easily. So Ma, how do we take care of that in the postnatal period?
Episiotomy or perineal tear. Let me talk about the difference. Though the care is the same.
Yeah.
Episiotomy is when the health provider gives you a cut, maybe give you a vaginal cut by trying to widen your vaginal orifice so that your baby can come out easily. Yeah, that is episiotomy. But the tear is when it's in the process of the birth. The child, maybe for one reason or the other, that the baby side is bigger than the pelvic outlet, forces its way out, and then there is tear in your perineal muscles.
Yeah.
That is the perineal tear. The episiotomy, in terms of repair, it is easier for your caregiver than the perineal tear, because it's a straight, clean cut that can easily be opposed and be sutured. But the perineal tear sometimes comes in a ragged form, and it's difficult it's really difficult to repair because you align your pose and stuff like that. So the first thing, the care is first is to see how you can suture the tear, especially when it involves the muscles. Sometimes, even if it's just the skin, if it's just a tear on the skin, I still want to suture. Yeah, but especially when it has involved the muscle, you will now have to suture. So that you can prepare the woman for her subsequent pregnancy again. So suturing from the hospital, that is one of the ways. You suture clean, and then you educate the woman on the care. And one of the care is being a bit hygienic with your reproductive organ, with your private part, by changing your pad regularly. Change at least twice or thrice. Especially the first few days, you could change it based on the flow. But you, just like I said earlier, you watch out for the flow as well. If you're having a soaked pad that is more than 1 in an hour, that's excessive bleeding. Yeah, you should seek for medical attention. But whereby it's a normal flow that maybe within 1 hour or more than 1 hour, you're just still within one pad, it's still fine. But you should try as much as you can to change the pad regularly. And also washing of your private part is one of the care as well, at least twice, in the morning and then in the evening. Then another way of caring for episiotomy or perineal tear, again, is what we call a seed bath. A seed bath is very effective for healing of an episiotomy or perineal tear. And by so doing, we mean getting a clean, warm water, not a very hot water. Let me stress on this, because some of them, after the education, they go on sitting on a very hot water, and it will make the wound to give way. Yes, sometimes it dissolves it, like most time you use a absorbable suture. When the water is too hot, you just break loose the sutures and the skin or the muscles won't come together. So we advise on a warm water that your body can tolerate, because even some of them, they can't even sit on it for some time because of how hot the water is. So it's a warm water that your body can tolerate. Then with some drop of antiseptics, could be Savlon, Dettol, any of the antiseptics available per time. You drop in it, and then you sit on it for some time. Like I used to advocate minimum of 30 minutes and then more. Then thereafter, you change your pad. You do that in the morning, and also you do that in the evening. Then another thing again is nutrition, good feeding. Feeding good nutrition has a lot to do in wound healing. So it's a woman that is being well fed, the skin integrity will be healthy, and healing can can take place. And also, you know, for the woman who is anemic also, the wound, the healing will have issues. That still boils down to nutrition. So, like, you know, most of them, we give them hematinics just to complement their blood, and immediately after the antenatal period, they will drop it. So if you're a woman that has been given an episiotomy, or you had a perineal laceration, continue with your hematinics. It will also help you, And then they take home drugs. And then we also give prophylactic antibiotics. So the woman to take to prevent any infection setting in as well. So take your prescribed antibiotics during that period with your hematinics, good nutrition, good sleep, good rest, clean environment, hygiene, and by so doing, you'll be fine, and it's only, at the end of the day, it's only the scar that can be seen for you to know that you've been given an episiotomy. So that's how to care for either an epi or a lacerations.
Yes, ma'am. Thank you so much for that explanation. I liked that you talked about sitz baths, because it's very important, because people know about, you know, the water should not be so hot. And also, if you are using salts in the water,
some use salt.
Yes, the quantity you should put that, you know, is antiseptic enough to help you care for that one is really important. So before we go, we'll just talk about contraceptive use, because I've had a patient that came, and then she came for antenatal clinic, and her baby was just 5 months, and she was pregnant for the next baby. In fact, I think the pregnancy was almost like 2 months already. And she was just lamenting, I didn't see period, or I don't know how this happened. And I was wondering if she was aware about contraceptives.
Yes, some of them are aware of the contraceptions.
Yes.
Some are not aware. But some are aware about the period as well. They will just think, okay, postpartum period is 6 weeks. Within that 6 weeks, maybe the man will not even think of coming close to them and blah, blah, blah. So they just want to relax, to take their time before they come for any family planning option. But the truth remains that anything can happen.
Yeah.
You said you've seen 5 months. I've seen 3 months. Yeah.
She was 3 months. Baby was 3 months, and then she's pregnant.
Yes. Yeah. I saw, even when I was in children's ward, I saw one. I think that was up to complete 3 months. Wow. Because this one was 9 months and this one was 11 months or something like that. 2 months plus. Okay. And you said, So, yes. So, that's why we are talking. It's
very
one
important.
thing. It's very, very important that you seek for a family planning option or method. In fact, we begin to talk about that from antenatal period. Yes, let them know the ones that are suitable during the postnatal period.
And the ones that are not.
Because it's not all of the methods that are suitable at this period.
Yes.
Yes. So just to talk briefly about it, because that could be a topic on its own.
Yeah, the large topic. So I think we'll talk about that on another day. So for today, we've talked about a lot of things to expect in the postnatal period. We've talked about, contraceptives. We talked about perineal tear, care of perineal tear, and lacerations. We talked about, why you need to come for, postnatal clinics, the importance. We talked about, depression, postpartum depression. These are very important things to, that you gain by coming for your postnatal clinics. So we'll be rounding up now, and next time we'll keep talking about other topics that, are important to your health. Thank you so much for joining us. Thank you, Mrs. Jane Abel, for coming on this program. I hope you're able to gain something from our discussions today, and you can make better health choices for yourself. Thank you so much for joining. Till next time. Bye.
And welcome to Clear on Health.
TSTV, connect